Switch up. Good morning, everyone. We're going to start the October meeting of the El Paso County Board of Health. I'm sorry, September meeting. Month ahead, sorry. Okay, we're going to start off with a roll call, and I'll start to my left with Vice President Doris Ralston,
Present.
Commissioner Cammie Bremer,
Present.
Dr. Deborah Chan. Is she online?
She's on her way. I just saw her.
Oh, okay. All right. Let's see, General Jack Briggs.
Present.
Councilman Dave Donaldson has texted me. He's going to be a few minutes late, but he'll be coming in later. Commissioner Lojinos Gonzalez.
Present.
Mayor Glant Havener. Present. And I see Dr. Chan just coming into the room. So, okay. Has everyone had a, oh, is that Dr. Vu?
I'm here, thank you.
Man, I see why we need Doris. I mean, she keeps me straight. All right, has everybody had a chance to review the minutes?
I wasn't present, so I will recuse myself for the approval.
Understood.
Briggs for the record.
All right. If you've had a chance to review the minutes, then I need a motion and a second to approve the, oh, I'm sorry, the agenda.
Doris Ralston, so moved.
Second.
And thank you, Commissioner Gonzalez, for seconding. All in favor of approving the agenda, let it be known by saying aye.
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 Any opposed? All right. We're going to open it up to board comments. I'll start with Doris. Any comments, Doris?
I would just like to extend my sincere appreciation to General Briggs for his enthusiastic dedication and support to public health, not just here, but I think globally, and his active participation. And you've been an inspiration to me, so thank you.
It's very kind. Thank you.
Commissioner Bremer.
No comments other than to echo those sentiments. General Briggs, you will be greatly missed, and the perspective that you approach everything that this board deals with is really impressive, and I think it adds to the conversation, adds to a bigger context for the community most of the time. So we will miss that tremendously.
Dr. Vu.
I also want to echo my appreciation. So I also want to echo my appreciation, General Briggs. I also want to, again, express my appreciation to all the staff here at El Paso County Public Health and all the good works that we're doing. Thank you.
Mayor Havener.
Thank you. You are a lot to live up to. I mean, you really have a pure heart.
Okay. Dr. Chan.
I'd like to echo those sentiments as well. We will miss you terribly and your expertise.
And Commissioner.
I will wait till item 6 when this when this actually comes up as a agenda item. Thank
Okay.
you.
All right, and as for myself, I've got a couple things to mention. The first is we do have a certificate for General Briggs, and I'm going to jump ahead to our certificate for General Briggs is a certificate of appreciation presented to General Jack Briggs on behalf of El Paso County Board of Health and the El Paso County Public Health for 2 years of dedicated service to the citizens of El Paso County, awarded on this 25th day of September 2024. Our certificate, in a man like you, in your career, you've had so many of these. They are just sometimes get lost and filed away. But behind this are the sentiments of this board, and I'm sure many of the staff. As mentioned last week or last month when you weren't here, in fact, I said so many nice things. Just read the minutes. No, I'm just kidding. But I do want to say that your life reflects service, and we're very grateful to have been a small sliver of that. You're taking that service that you did here and at the rescue mission on top of a brilliant career in the military, and now you're extending that service to the students, faculty, and staff, and even the citizens of Boulder. And for that, we are all grateful. We wish you the best of luck. We know you're going to do wonderful things up there for that community, to make the entire community that is centered on that campus. You're going to make everybody safer. So we're very grateful. So I'm going to hand you this certificate. Shake your hand.
You're just right over the top of Susan.
And then could we do a photo op?
You bet we can. Sure.
If we can have.
I'll move out of the way. Do you want us here or there, or just the lights shining?
Yeah, we can do. General Briggs is in the middle honor. Can you have you in the middle? Okay. And then. There's three. All right. We'll take a few photos.
Okay, give burritos.
No, the Danish is good.
Okay. Oh, okay, good.
All right, as we broke from our
As I would like to
photo,
make,
I'm sorry, Commissioner Gonzalez said that he would like to say a few things.
Thank you very much. I think it's the military part. It's like, well, I'll just wait till the agenda item before I start thanking the general. But Jack, thanks for all the great things you've done with the community. I think that's what we see. We see it in civilians, but with the military members, I think you see this dedication. They want to just continue the service to the public, and you've done that in everything you've done since retiring, and you've continued to do a great job here, and you're going to continue to do it up in Boulder, unfortunately, but I appreciate all the great work, and I know you're going to do great things and continue to do great things.
thank you. If I could, I arrived in Colorado Springs to be the CEO of the rescue mission in the summer of 2020, and we had a little health issue going on at that time. And it became very clear to me very quickly how critical our relationship was going to be to healthcare providers and, more importantly, policy makers during this very unstable time. And I recognized very quickly that Director Whelan and the team were going to be vital to what we did at the rescue mission with hundreds of homeless and addicted. That got me interested. Right, the relationship that we built initially right there got me very interested in this idea of partnership with the board, with the department, and with the staff. Because I saw this staff at the rescue mission when a lot of other folks wouldn't show up. And that was very important to me. And so when the opportunity came to join the board, I jumped at the chance. And I've only been reinforced by the talent and dedication of a small but highly leveraged group of people who put service before self. That's what you do as a staff and as a leader. And I am of two minds and torn over the decisions that my family and I have been making over the last few months. They're all good decisions, but they all have consequences, and one of those consequences is today. And I feel that more today than I thought I would, but again, it's because I really respect this board. I respect our previous board members that I had the opportunity to work with, and the staff in particular. And know that you have an advocate out there all the time, regardless of whether I'm on this board or not, because I know the value and the intensity of your commitment. I would ask you to maintain that. I know it's hard sometimes, but your impact goes well beyond just the initial contact that you have with the individuals in your particular fields. It echoes out from that in families, in communities. I see it in the homeless and the addicted on a daily basis. You're making a difference. So on behalf of those folks and just myself, I want to say thank you to everybody.
Susan, did you want to say something? I'm sorry.
So I would like to extend a deep gratitude, General Briggs, to you on behalf of our staff. You know how crucial partnerships are. And a lot of times what happens 24/7 with our teams out in the community, you have had a first hand look at that. And I appreciate that because I think that our staff is pretty awesome. And they are so resilient and have a service mind as well. And they do a lot. And you're in that same team, as a board member. And I've appreciated that you have shown, through showing up at even different events to support, whether it's me or our staff, or serving on whether it's public safety committees, knowing that how critical the relationship is for public health and safety. It all goes together, and just know that you're very appreciated, and we appreciate the time that we've had with you, the short time that we've had with you. And I would also say, go Buffs.
Yeah, go Buffs.
And there will be another public health director. Her name is Lexi. And I'm sure that you all will connect in Boulder. And just wish you all the best on behalf of myself and our entire team.
It's very kind. Thank you.
Okay, the other comment that I want to make is last month we had a presentation from and forgive me if I say this incorrectly, the Suicide Prevention Coalition. Is that correct? Did I do that right? They did a presentation, and then a few days later, I had the opportunity to show up at the all-staff forum, which was held at the, what is the name of that location where we did it?
The Valley High office.
The Valley High office. And at that time, I heard Brittany Riffle give a presentation. And the presentation, among other things, what it did for me is it taught me some new language, some things that maybe the old language is passé or maybe even be hurtful with regard to suicide. And so I would encourage all of the board members, if we have a chance, maybe we can get Brittany to do that presentation for us sometime. Because I think it was really beneficial. But there's also there's a safe messaging training that I think is important for all of us so that we're using the correct language when we're sitting in these positions as board members. We want to be saying the current up-to-date things. And things change all the time, right? Language that we use in really any field is always evolving and changing, and that's for an effort to do things right, to be more accurate, to be less hurtful with the wording that we use, and all of those things make a difference when we are messaging correctly. So just an encouragement to the board to do that safe messaging training.
I will say that we have a video that we will send out as well. It's probably maybe about 5 or 6 minutes. And the executive director who was here previously last month for the suicide prevention proclamation, she has she's the one that's in this video, and is just talking about safe messaging and how do we talk about suicide is very important. And in 2014, we developed a video also. We reached out to all of the news directors in El Paso County and wanted to do some training for their reporters, because the way in which we talk about suicide is so critical as it relates to the topic and how we're working best together. And, as a field, public health, it is always evolving and we're always learning. So I think that, having educational resources and being trained on them, we've got some in-house experts, but we also have numerous different experts that we work with different coalitions. And, they are watching. and they are invested into the Board of Health's leadership as well as our entire team. And so thank you, Mr. Colas, for bringing that forward, because it's such an important topic. And in my field, it's one of the most difficult topics that I've ever worked on. And I really appreciate that you're bringing that forward.
You bet. The other thing is we just said our goodbyes to General Briggs, who isn't leaving the room. He's going to stay with us through the rest of the meeting. But that seat is going to become vacant. And let's see, in early October, Board of County Commissioners is going to be accepting applications. The applications for General Briggs's vacancy are going to be for a nonprofit, a profit, or education individuals with that kind of a background. So we would, I think, for me personally, I think that having a nonprofit leader in that seat was very beneficial to the construct of the board. So hopefully we can get some good applicants that the Board of County Commissioners can interview and get a top-notch candidate to try to fill that seat. And now, although I talked about approving the minutes earlier when I meant agenda, now we will approve the minutes. If you've had an opportunity to read the minutes, I'll need a motion and a second to approve the minutes from last month's meeting. Thank you, Commissioner Bremer. And a second?
Gonzalez, second.
Thank you very much. All in favor of approving the minutes as written, let it be known by saying aye.
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 One
Any-
abstention.
And one,
And I abstained, I wasn't here.
okay. So we have General Briggs and Doris Ralston both abstain from the vote, and the rest are all in favor of approving the minutes. Okay, public comment. Do we have any?
We have no online comments.
No online comments at this point? Great, we'll move forward to finance and budget, the August financial summary.
This is on. Okay, I think it's on now. There we go. Okay, good morning. I'm Sarah Kinney, Budget Manager for Public Health. So as we begin, we'll take a look here at our month-end August 2024 executive summary. Our revenue is where we always begin. As you can see, we're trending on track for our state and county funds right as scheduled per our budget. That's why you see no variance in those first two lines. Okay. Very good. Then as we move down to our program-specific grants, this is a bit of a timing issue. As you guys know, these are reimbursable grants, and so as we submit those, it's about a 30 to 45-day turn for those reimbursements to come in, and so those are under our trend a little bit. Our licenses, fees, and permits, we are expecting to come in under what we had budgeted for our trend there. So we are watching this very closely. I have coordinated with our acting division director, Deanne Ryberg, and she is working to use some vacancy savings to offset that, that budgeted amount that is under trend. So we are watching that very closely as we move towards end of year. Our Medicaid fees and insurance are coming in a little bit higher than anticipated. This is due to some of the higher volumes at some of the clinic. We are also doing a closer look each month with our division director there, Summer South. We have a meeting scheduled for later this week to keep a close watch on those items. Our interest income is once again trending higher than our budgeted amount due to higher interest income and due to our healthy fund balance that we've been discussing month over month. And our contributions and donations miscellaneous has a slight variance there. Any questions on revenue for month-end August? Okay, moving on to expenditures. We continue to accrue a variance in our personnel line, but I do not anticipate a large personnel variance by the end of the year. That is due to a small benefit adjustment, which is coming in each month, which will use up some of that variance, as well as I'm anticipating that there may be a one-time payment that may or may not be voted in by commissioners that could use 4 to 5% of the personnel expenditure for the year, which could be about $750K. So that would spend that down. Additionally, each year, retirement and PTO spends about $200,000 over the course of a year. We've only spent about $100,000 of that. So we would spend down into that 1.5 that we've accrued. Looking at operating, we do have some invoices that I expect to hit that would spend some of that. And then in capital, I do anticipate that we will move some of those ARPA resolution dollars down into that line through a budget transfer this month, which should resolve that slight overage that you see. Any question on expenditures? Okay. So as we move towards the end of the year, I do not expect that we'll have a net impact savings of $327K. As we're sitting, I do expect we'll come closer to the mark and not leave much revenue on the table at all. I think Director Whelan is expecting that we will use all of the funds planned for the benefit of our community at this time. So we are looking very closely at where we can execute best on all of our programs, and I'll be coordinating closely with our new operations director to make sure that that happens. Any questions? Okay, thank you very much.
Thank you, Sarah. Okay, we've got some contract renewals in front of us. The first one is the drug-free communities.
Good morning. My name is Daisha Hudson. I'm the Community Health Promotion Division Director. I'm pleased to let you know that we hired a new program manager for the Communities That Care team. His name is Brian Baxter. However, he's only been with us for a week, and so I'm going to be presenting that contract on his behalf. So as stated in your board packet in the contract synopsis, we are seeking your approval for this Drug-Free Communities grant renewal for the Communities That Care program in the amount of $125,000 for the federal fiscal year October 1, 2024 through September 30th, 2025, to continue the work which supports collaboration among local partners to create an infrastructure that reduces youth substance use. This contract was first approved by the Board of Health in 2021. This grant is renewable for 6 additional years, and we are currently seeking approval for our 3rd annual renewal. The team looks forward to continuing to partner with local schools and local law enforcement on strategies to encourage safe disposal of medications with these funds. Do you have any questions?
Go ahead, General Briggs.
Briggs for the record. So there's emerging data showing a decrease in overdoses across the nation. Are we seeing, and you may not have this data now, but it would be something to bring to the board, a trend here in El Paso County? There are a variety of different potential explanations to include more ubiquitous use of Narcan, more tolerance, like physical tolerance to the drug, fentanyl, which can be superseded by just a stronger version of it, or a hyper version of it because it's a chemical. And also stigma. I've heard stigma is associated with, well, I don't want to be seen as like a fentanyl person, right? Now, it doesn't, I think, apply to the misuse of what would be considered prescription drugs. But I just wonder for feedback if we're seeing something similar. Thank you.
So I appreciate your questions, and I'm aware of, the information that's, I think it's pretty recently come out about the trends. I would like to take some additional time to meet with the team and gather some of that information, but I think we could come back with we could look at the data that we do have and come back with some information.
It'd be great to be a national leader in that trend, wouldn't it?
I wanted to make a note also. We do have a data dashboard, which we recently launched, and I know previously what we were seeing was a little bit of a leveling off that was hopeful. And so I would also ask Dr. Bernadette Albanese if you have any insight into this now, but we certainly can come back, we'll have to look into that. But we know that it was starting to level off, and anecdotally related to equipping numerous different organizations and law enforcement, sheriff's office, Colorado Springs Police Department, the fire department with Narcan. That when we're around the tables, that is a discussion around a piece of it, but not all of it. Good question.
Do you want to?
Yeah, so my add-on would be, so with the local hospitals, do they track when they have somebody that's brought in, like for an emergency, that has been saved by Narcan? That would be kind of add to the potential statistics. I just even wonder if that's even tracked.
Councilman Donaldson?
Yeah. Now or now?
Now.
Now? For Jack Briggs, the data you're talking about, is it overdose deaths have gone down or overdoses? Okay, so just deaths. All right. Thank you.
Okay, we need a, I'm sorry, Cammie.
Thank you. Back to this actual contract. This is a great program, and the DEA's drug take-back days are very well run here. I do often have the question posed, are there any plans to have kind of permanent lock boxes or stations for drop-offs outside of the weekend or the 2 weekends a year that those are offered to our community? Can we work with some partners on taking a look at where that would be useful? The ones at the hospitals tend to be full all the time. And so I've heard a lot of questions about where can we do this outside of this weekend? Because otherwise families are holding them for 6 months or a year in a medicine cabinet, which is beside the whole point. So I would love to know if there are any plans for that. I'm excited about what we do have. Certainly, I'll be happy to make a motion to approve this contract when it's appropriate time, but would love to know about that.
That's a great question. Sorry, I didn't mean to interrupt you, but that's a great question. I've actually just been reviewing the team's sustainability plan, and that is part of their sustainability plan, looking at that this next year. So this funding is specific to the Fountain Valley area, so they're going to be looking at a permanent location in Fountain Valley. And that's something that they're going to be focusing on this next year with this grant specifically. But I think there's ways for us to partner throughout El Paso County to look at other locations as well.
Okay, Dr. Chen.
I have two questions. One is very straightforward. Well, they're both very straightforward. And that is, under this grant, is the definition of youth under 18 or under 21?
Oh, that's also a good question. I don't want to misspeak. So the team is online. So we have a lot of different grants, and they all define youth differently. So I want to get it right. Carissa or Kimberly or Lene, are you guys online? And does anyone know the definition of youth for this grant?
Yes. Yeah, so Kimberly and I are here, but we're attending the Public Health in the Rockies conference. So I think the definition for youth for us is 24 and under. So a lot of like the youth programming that we have, we cap it at 24 years of age.
Okay. And then my second question has to do with the drug take-back.
Mm-hmm.
Are the drug take-back days for all prescription drugs, this 248.1 pounds, does that include all prescription drugs or specifically prescription drugs that have the potential for abuse?
I believe that's all, but I'll refer to the team.
Yeah, hello. This is Kimberly, also attending Public Health in the Rockies, sitting right next to Lene. And in answer to that question, it is for all prescription drugs that we will allow to be provided by the public into those drug take-back days.
So it's not just ones that could potentially, it's all medications. They're collecting all medications that are just sitting on your shelves. But with the intent of getting the most dangerous ones out of your home to prevent.
So with the drug take-back days, do you track the amounts that are
Collected?
collected that are potential for abuse?
I don't know that we separate. So I can tell you that the team collected 248 pounds of medication, unused medications last year, but I don't know that we're separating it out by, whether it's a narcotic or not. But again, Lene, Kimberly, if you can better answer that.
Yeah, so we are not separating that out. The team is not allowed to have very much hands-on contact once that medication has been collected. The police department manages all that. So at the end of that collection day, all we get is the weight or the poundage of how much was collected at each site that we have.
Thank you.
That's
You're
definitely something
welcome.
we could ask about, though, if that's, it might be something good to track in the future. We can ask if law enforcement could do that.
Yeah, certainly if the goal is to reduce substance use, I think it would be useful to know what proportion of the collections are actually going to be reducing access.
Thank you.
Okay, Councilman Donaldson?
I promised my last two. And one question is, it says the grant requires representation from 12 sectors to address two substances. I get the 12 sectors. What's that?
So that's just all the different community sectors, so law enforcement, education.
Okay. Very good. And then does public health, do we in this building have a drop-off box for expired meds or meds?
I don't believe so, but
Is that something that's been considered in the past and was decided that's not good for us to do for this reason? Or is that a reasonable thing for public health to participate in and say, you know what, let's just have a drop-off box right here and we can advertise that, or in our two locations?
It has been discussed over the years and with the Colorado Springs Police Department as well. And it hasn't moved forward due to some of the requirements. I'm happy to have a conversation in more detail, but we have asked around, hey, wouldn't this be a great idea? And through those conversations, it has not moved forward. And we do have some drop-off collectors in the bathrooms as it relates to needles but as far as just a general drop-off box, we do not. We do have on our website, if it's still there, you can put in your zip code, and then you can find out where a drop box is closest to your home, and so there are existing drop boxes, throughout the county. Mm-hmm. They might not be plentiful, but there are some. Mm-hmm. But I'm happy to touch base with Colorado Springs Police Department and see if this is something that they might be interested in. Public health alone, we're not going to be able to manage something like that, but I'm certainly happy to bring the question back up if you would like me to.
Yeah, if it's true, as Commissioner Bremer was saying, that, hey, they're full at the hospitals, or it's really it's hard for citizens to be able to find a place to get rid of the Percocets that they don't want in their house anymore. It seems like that would be a good service from public health to have a place, okay, come to public health, we can take narcotics. Or originally I said expired meds, but maybe we don't want it that broad, but it's going to be hard maybe to know what's going in the box. I, for one, would appreciate if we looked at that, providing a service like that. Even if there is a way we have to figure out to fund it, maybe a fee on pharmacies or the places that all these meds are coming from. If they don't have a easy drop off for meds, expired or narcotics, then we can provide that. We just have to find a way to fund it. And there's issues too with meds going down the toilet, and then what that does to the water supply. So
I know that the Colorado Springs Utilities participates also and has education, but we'll circle back and bring that information forward. And we do have a very large opioid council as well, as it relates to maybe that is something that there can be some involvement there and a push, because we do know that as prevention, check your cupboards, and if it's expired or not, like that's an easy access point as well. So we need to be mindful of that. So we'll look into it and bring that back.
Good. General Briggs?
I would offer to Councilmember Donaldson, if he has something he'd like to drop off, he can come to the rescue mission. We take it every day. We've got a Dropbox.
There's probably a lot of things I'd like to drop off over there.
And
but
we'll
might
take
not be
donations as well.
medicines.
I just want to point that out.
Lene has her hand raised. Lene?
Lene?
This is Kimberly Disnute once again. We just wanted to add to what Daisha had said about,
Kimberly, can you speak up?
can you hear me?
Yes, now we can.
Thank you. We just wanted to add to like what we're doing down in Fountain as well as with that, with informing folks of like permanent locations of where they could drop off expired medications or unused medications all through the year instead of just waiting for those 2 drug take back days that we do. So during those events and even during like when we're tabling for any reason, we provide an information sheet that lists all the sites that we know of where in both in Fountain and in all of Colorado Springs of areas of where they could drop off medications, expired medications or unused medications all through the entire year. And then also following up with a comment from Commissioner Brimmer about permanent sites, we are trying to expand. There's a new King Soopers coming down in that area, and we have plans to talk to that King Soopers about hopefully maybe having a permanent site in their pharmacy. So just some things that we're exploring as far as making like that an opportunity for families and individuals to drop off medications throughout the entire year instead of just waiting for the 2 times a year events that we do. And then Lene wants to add something about our lock boxes.
I just wanted to add, so we just recently worked with our D3 and our D8 school districts. And so they actually came to us and said we would be interested in lock boxes. So within the last couple months, we gave them both a supply of lock boxes, and they have given us some positive remarks that those have been handed out. And families are thankful that they now have a place for safe storage inside of their houses for their families.
And also, we've even had a story come back to us of a family, a school counselor that was talking to a student, or no, talking to her mother. Her mother called and said she had a concern about prescription medications in her home, that she felt like some of them were disappearing, and she asked if there was any resource that she could get to make her home safer. And that counselor was able to say, like, we have these lock boxes that have been provided from Fountain Valley Communities That Care. And then she gave one of those lock boxes to that family so that that mom could feel that her home was safer for her children.
Thank you so much, Lene and Kimberly, for adding that additional context. Are there any other questions?
I think Dr. Albanese has a little information on what General Briggs brought up.
Hi, Dr. Albanese, Co-Medical Director. So all great questions from everyone. Thank you this morning. Just regarding the drop boxes and it's to your question, Dr. Chan, it's basically a safety issue and a confidentiality issue. So there aren't going to be people sort of sifting through, looking at prescription bottles to see what's on there for safety reasons and for confidentiality reasons. And then remember, for narcotics, these are controlled drugs, right? So DEA has a hand in this. So the reason that there's restrictions and sort of rules and safety things is just not only, we want those medications out of the home if they're of no use and potential for abuse by people who aren't supposed to be taking those meds, but there's clearly a pretty significant safety issue that needs to be addressed. Getting back to the questions about drug overdose data that I was just trying to look up for you real quick. So looking at data for El Paso County and the state for basically unintentional drug overdoses, so these are the not suicide attempts, so unintentional. Director Wheeling, you were correct. So we're at a flat line now. So since 2019, they shot up, very much driven by the fentanyl situation around the country and in our state. But both in the state of Colorado and in El Paso County, we're now leveling off. And we'll take that, right? Like, it's not like you're going to see something necessarily go up and then tank. I think it goes up, levels off, and then we see it turn around. That's still a good trend. So I think for the past 3 years, for El Paso County for unintentional drug overdoses of any type of drug. They've been hovering around 200, and in the state around 1,600. So the Colorado has leveled off as well. So we're actually sort of consistent with the state pattern. So the goal now with the Narcan programs and so forth, and then whatever can be done and hopefully successfully done regarding the fentanyl situation, is to hopefully see that turn around. So we'll take a leveling. It still means something, even though we haven't seen it necessarily drop in our county. And the trends are still the same: higher rates in males, higher rates in kind of middle-aged adults. So that's been pretty consistent over the years.
Thank you, Dr. Albanese. Great discussion, and during the discussion, Commissioner Bremer said that she would put forth a motion to accept this grant renewal. We need a second.
Briggs, second.
General Briggs does a second. All in favor of this grant renewal, let it be known by saying aye.
Aye.
Any opposed? Of course, it passes unanimously. Bet you didn't think you were going to be standing there this long, did you?
That's okay. They were
Okay.
great questions. Thank you.
All right. Next one, maternal and child health contract renewal.
So Jennifer Massa and our WIC program manager. So Jennifer Massa is our maternal child health program manager, and Melissa Gordon, our WIC program manager, are at Public Health in the Rockies, but they are going to be presenting virtually. So I'll stick around though, just in case we have any technical difficulties.
Good morning. My name is Jennifer Mussa. I am the Division Manager for the Maternal and Child Health Program. I am presenting our contract renewal for the Maternal Child Health Grant. As stated in your board packet in the contract synopsis, we are seeking your approval for this Colorado Department of Public Health and Environment grant renewal for the Maternal and Child Health Program in the amount of $615,272 for the fiscal year October 1st, 2024 through September 31st, 2025, to continue our work which supports improving healthy child development and improving well-being of all children in our community. We provide resource navigation and education to caregivers and community members. This contract was first approved by the Board of Health in 1981, the last being in October 2023. This is a block grant and it is renewable every year for level funding. We're excited about continuing to serve families in El Paso County through resource navigation and continuing to work closely with youth serving organizations. Any questions?
Any questions from the board? I don't see any questions. Thank you very much, Jennifer. I'll need a motion to approve this contract renewal.
Gonzalez, move to approve.
Thank you. And a second? And thank you, Mayor Havener. All in favor of the maternal and child health contract renewal, let it be known by saying aye.
Aye.
Aye. Any opposed? And there is none. Women, infants, and children, the WIC program contract renewal.
Good morning. My name is Melissa Gordon, and I am the Division Manager for the Women, Infants, and Children program, or the WIC program. As stated in your board packet in the contract synopsis, we are seeking your approval for this Colorado Department of Public Health and Environment, or CDPHE, grant renewal for the WIC program in the amount of $3,273,628 for the federal fiscal year October 1st, 2024 through September 30th, 2025, to continue our work which supports income-eligible pregnant, postpartum individuals, infants, and children up to age 5 through food benefit issuance, nutrition education, and breastfeeding support. This grant is renewable each year, and we're happy to be able to continue to serve the families in El Paso County. Is there any questions?
General Briggs.
General Briggs, for the record. My first question is one of just ignorance. A couple years ago, maybe even a year ago, we were debating or talking about formula and the availability of formula in the community. Has that been resolved?
It has definitely improved from the substantial shortages we were seeing, back in 2022. We still have the occasional issue with formula stocking, especially with our medical, specialty medical formulas, but it has certainly improved. And on a whole, individuals are able to find the formula that they need.
So in the areas that are specialized formula, is there a path to getting healthy with that as well? Or is that just something that is endemic in the nation because of who makes it?
It's a really great question. Formula manufacturing is very complex, and there are probably a lot of reasons well outside the program control as to why formula stocking is not as stable as it could be. For certain formulas that individuals are not able to find in stores, the WIC program is structured in such a way that we are able to order our specialty medical formulas through a couple different specialty pharmacy that the state WIC partners with.
Okay, thank you. And my second question is, just in terms of resources, there appears to be a decrease in funding for this, while obviously food costs have gone up in the community. Can someone walk me through that, please?
Melissa, you can tag along here. Essentially, what has happened is the state looked at the funding formula, and they have changed the funding formula around the state. And unfortunately, El Paso County received a funding cut. And part of that funding cut was related to the number of clients. So there's a few different aspects that go into that. I was recently at a Colorado Association of Local Public Health Officials day meeting on, I think it was on Monday, and one of the items was related to how the Colorado Department of Public Health and Environment approaches funding formula changes and how to involve locals, because they had acknowledged that the WIC funding formula change did not go well. They own that. And so with that, meaning that it would have been beneficial if El Paso County would have had leadership there and highly involved. It ended up in a place where, around the state, the majority of the public health director supported. And usually when we have a funding formula change, El Paso County does well because we have the most populous county, and that's part of the funding formula. But in this situation, it took into account the clients, and over the years, as it relates to even whether it's staff vacancies or people are out for various different reasons, and we're not able to see the number of clients in which we could. And so we have talked internally around next year, if they reassess, what are some strategies that we could bring forward to get support from the board to actually have a more beneficial funding formula to El Paso County as it stands. But bottom line, the funding formula has changed, and we were not in control of that. And that's the reason why. And with our grants, some of them have been flat for decades. We've dealt with this challenge because the majority of our funding comes from grants and contracts, and so we are poised to have some additional grant funding next month through the CDC to backfill this grant. But this is something that unfortunately we have to manage as an agency when grants are flat. The needs increase. What do we do there? That's why the Board of County Commissioners and the funding that you all provide is so important. That's one of the reasons why the State Health Department related to, in the long bill, the per capita funding from the state is so important, is because some of these grants, they haven't been increased, and then the funding formulas, they can change. Now, I did ask the question with the State Health Department, are there any other funding formulas that are being looked at? What is on the list? And they had said that currently there is nothing on the list, because I do want to know if there is some other grant that they're looking to change the funding formula. We need to be engaged in that. And my deputy also, Deanne Ryberg, was there, and so we were engaged in that conversation. But so that's the reason why.
Director Wheeling, so you mentioned something about, so population, that makes sense. You said they also took into account the client. So you mean the number of clients, or do you mean like the income level of the client, or the
Yeah.
race of the client? I mean,
Yeah.
what
So,
factors?
and Melissa or Daisha, if you want to get maybe a little bit more into the weeds, but I'm talking about the number of clients. And so I do know that where there have been increases in some of the funding, because the pot of funding was not going to go up. So they had changed the funding to distribute it differently and more equitably and related to what they put in the funding formula. And so I understand that Weld County, and I think it was Denver that received some increases in funding, but what I'm talking about is the number of clients. But then again, too, there's so many variables as it relates to what does our staffing look like, and we know that we've been very stretched as it relates to caseloads and those kinds of things. So that did impact. And Daisha or Melissa, if you have any other details around the funding formula.
Can I ask a question about funding formula? It actually kind of coincides with C and D with the breastfeeding peer counseling contract and the other. If the funding formulas are changing and the WIC contract renewal is going down, what are we doing within both of these grants to teach women who maybe otherwise wouldn't have peers teaching them to teach women to nurse to save money on formula?
Okay. So I think we will definitely address that one in the next contract renewal, because that's what that whole grant is geared towards, is supporting women who are breastfeeding through our peer counselor program.
I mean, it's obviously less expensive. I'm just saying, what are we doing to, kind of on the same lines as we were talking about with drugs and communities and having a safe place to take things. Like if these are populations of people that aren't traditionally taught to nurse and taught the health benefits, the immunity benefits, and the money-saving benefits, are we putting more factors into teaching women to breastfeed as opposed to buying formula?
I would say that we do emphasize, and that is something, one of our main priorities actually, to teach about breastfeeding and support and provide some resources for that. The Women's Infant and Children goes beyond formula as it relates to food and nutrition. But yes, that is a major priority for the WIC program.
And I'm sure, Melissa, if you want to chime in, I know they do so much to support breastfeeding moms. They provide breast pumps, but I'll let you, because I know you can speak to it better.
And there's a bit of an echo.
It's not echoing on our end.
Okay, I think we're good. Yeah, so the components of the funding formula also included geographic density, percent of high-risk clients, percent of non-English language speakers, and then some adjustments based off of where people lived. And Director Wieland gave a very accurate overview of El Paso County's caseload has continued to go up, but specifically Denver and Weld has continued to go up even more. And so when there is the same pot of money, we are going to see those impacts. And then when it comes to breastfeeding, yes, we have a number of our dietitians, our high-risk counselors are also certified lactation consultants. And we also have one international board certified lactation consultant with a few others also in training for that. All of our staff are trained in breastfeeding support as well. And then we also can loan out hospital grade, medical grade pumps for anyone that is pumping. We also have some partnerships in the community where we have taught partners how to best support our mutual clients, even just with things around like breastfeeding spaces or general support. So yes, that is one of the core components of the WIC program.
I also wanted to mention that, part of, our strategy for the last few years is to increase access throughout El Paso County. And I will say that with that, we are in northeast portions, Calhan, at the fair, all the way to Fort Carson. We are mobile and trying to increase access. We have expanded services also through the Commissioner Gonzalez in your area, in the Fountain area, through Public Health South. And I know that you just had an event there, I think, on Saturday. And then we also have a WIC clinic in Pikes Peak Park, which we call the Valley High. So this is a very important program, and I also want to assure staff that we're not doing any layoffs, because when you talk about funding cuts, it does make people nervous, and so we are fortunate to be able to have a really great development officer where we are going to bring before you next month a grant from CDC that is actually going to backfill this. But we will have to continue ongoing strategies as it relates to funding, but that's no different in the WIC clinic as just the entire agency. That's how we have functioned for, throughout these years is really piecemealing, some of the grant funding together. But I did want to assure staff, if anyone's listening, that to put them at ease, because if there's a funding cut, I don't want anyone to think that what's coming next.
Commissioner Gonzalez.
Thanks. I'd like to see the numbers for us in Denver. So our estimated population or use in El Paso County, use in Denver, and then how much they got and how much we got, if we can do that.
Sure. Melissa and Dacian, I'll work with you on that, and I think we can go beyond that and provide it just for all counties, because I do understand that what I had heard was that Weld, they had a significant increase as well. So we'll get you that information.
I'm having trouble understanding how the funding formula is not a loop or a spiral if it's based on the number of clients that are being served by this program. If there's a funding cut, it seems like the number of people that you're going to be serving is going to be less, so that if they base the funding formula on the clients, then each year there's a potential for a decrease. Is it based on potential clients by looking at the demographics of the county, or is it based on the actual clients that are enrolled?
I think, Melissa, you talked about that it's based on a lot of different factors. Can you go through that list again?
Sure, yeah. And in the background of this is, so the WIC federal funding is not based on a per client number like SNAP is. So at a federal level, Congress decides how much the WIC program is getting at a national level, a federal level, and then it comes to the state. And then the state funding formula, though, is where they are figuring out how much is going to each local agency. So there was a cost per participant that was the main part of the funding formula. So where we would see the decrease despite our increase is if other agencies are increasing essentially faster in their WIC enrollment. And that is what we have seen in the past year. El Paso has continued to have increased enrollment in our WIC program, but so has other counties. The other components was geographic density. So El Paso County benefited from that because we are spread out, whereas other counties, maybe their whole population is kind of centered in one spot, or a rural county where it's really spread out. So we benefited from the geographic density. And then we had a percentage of high-risk clients. So our clients that do need to see dietitians, and that was in comparison to the overall state percentage. And we also benefited from that. We do have a high percentage of clients that are considered high risk in the WIC definitions. And then there was also percent of non-English language speakers, and we were right on the state average, so we did not see additional funds for that. And then there was some adjustments if we serve any client who does not live in our county, because this is not a county specific. Anyone can live anywhere and be served by our program. We had a very low number of clients who live outside the county, which we would expect to happen just with different work locations and things like that. And we would see some additional dollars depending on where people live.
And I think
Did that answer your question?
I think that's how, counties like Denver and Weld have seen an increase because of that. The state's calling it a churn. And so like a county like Adams County actually saw a reduction, even though their caseload was high, because some of their people are going to Denver to be seen, to receive services. So Denver received an increase to account for people coming from surrounding counties. And so 85% of our funding formula is the average enrollment that comes from there, and then 10% are the adjustment factors. So the geographic density that Melissa was talking about, we did receive a decent amount of money because our county is so diverse and spread out. And we are, we have our mobile clinics and we're trying to reach people all throughout the county. Our non-English speaking and then high risk. So there's those buckets that accounted for 10% of the funding formula. And then there's partnerships. And so the state had offered the ability to partner. We looked at that. We explored that with Teller and some other counties. It really didn't make sense for us and for Teller and any other surrounding counties. However, they did redistribute some of those partnership funds because there wasn't a whole lot of people that applied for those. So, but I think, when we look at Denver and they're getting an increase, but yet we have more population, it's because they have more people from the surrounding counties going to Denver.
Go ahead.
Question and then kind of a question. Demographic density, I thought initially, you would get more if you're like in an inner city, high density, but it sounds like it's in your favor to be rural or spread out. Is that right?
Yeah, it
For
was definitely
funding?
in our favor. We received
Okay.
more money than other counties
Okay.
because of our geographic density.
Okay, and that may make sense. The one that makes absolutely no sense to me is it sounds like you're going to be punished if your clients speak English, right? You will receive less funding if you have English-speaking clients. Is that right?
So I don't know that, I wouldn't say punished. I think we would receive more funding to support the staffing needs that we would need to support non-English speaking clients.
Yeah, and I think that's absolutely wrong. I mean, these are federal guidelines, right? So the United States government is going to give less money to counties where they have Americans who speak English. I think that's terrible. It's not an issue for us, really. It's just, I didn't know that until hearing it here today. It's just ridiculous what kind of government, I'll use the word, punishes counties where the people are native and speak English. It's ridiculous, but thank you for what you're doing.
Understand. Thank you.
I wanted to just make one note, a side note to the board, is that we have a very, very healthy fund balance. It's almost double of what the Board of Health policy states, and that's over the last few years as it relates to some of the vacancy savings. And so if, any board member or if there's an interest as it relates to some one-time funding, as it relates to Mayor Havenar, you had mentioned, how important education is as it relates to breastfeeding, and we do have a grant. However, if the board, desires for us to focus in, some area that is not, ongoing funding, but a use of one-time funding for the fund balance, because that is, it's extremely healthy, and just wanted to note that that is available to you all.
Thank you, Susan. And I'd kind of turn that around on you and staff. If you know an area where you could benefit or where our community can benefit from a one-time expenditure, please bring those things forward to us, because you're certainly more aware of those things than we as board members would be. But we would be supportive of
Yeah,
staff.
and I would just say, planting some seeds is that when I talk about strategies of, maybe we, have a strategy of hiring more women, infant, and children educators so we can actually increase our caseload because the need is out there. And then when the next time the state does the funding formula, then we're at a better advantage. But so we certainly can bring some of that forward. But I just, if any board member has an idea or an area to please speak with me offline, because there's a lot that we can accomplish together, and just wanted to note that we do have a very healthy fund balance.
Okay, lots of discussion. Okay, Cammie.
I'd like to move approval of this contract, please.
Ooh, beat me to it. And we got a second from Doris Ralston. All in favor of approving this contract, let it be known by saying aye.
Aye.
Aye. Any opposed? There is none. Okay, do we have one more then? Or was that the second?
We've got the WIC.
This is me again on the breastfeeding one. So thank you for all your questions on the WIC grant. So this is for the Breastfeeding Peer Counselor Grant. And as stated in your board packet in the contract synopsis, we are seeking your approval for the CDPHE grant renewal for the WIC Breastfeeding Peer Counselor Program in the amount of $148,767 for the federal fiscal year October 1st, 2024 through September 30th of 2025 to continue our work with pregnant and postpartum WIC clients through peer-to-peer breastfeeding support. This grant is also renewable each year. We are happy to be able to continue to serve families to support their breastfeeding goals. Are there any questions on this one?
One quick question, and I'm hoping it's just a clerical error. The description, the synopsis mentions Boulder County.
We do receive additional funds through CDPHE as part of this contract to also serve Boulder County clients. This is a fully remote program, so it is texting and the occasional phone calls, and we do support that through the additional funds through CDPHE.
You're getting a big smile from General Briggs. So. Okay, I need a motion and second.
Can I ask a question first?
Please.
So how much funding do we get from Boulder County for the services we provide?
That's a great question. So it comes from CDPHE as opposed to from Boulder, and they just give us the total grant amount of this $148,767. They did not break it out, and they have not in the past. I did ask, and I have not gotten a response yet. So when I do, I'm happy to provide that information.
Thank you.
I
Okay.
will be happy to make it less awkward for the men in the room and move approval of this.
Okay. Thank you, Mayor Havener. All in favor of this contract renewal, let it be known by saying aye.
Aye.
Any opposed? There is none. Okay, we are moving on to a resolution now. I believe that it was at our last meeting that, and correct me if I'm wrong, I thought it was Councilman Donaldson that brought this up. Was it Commissioner Gonzalez brought this up? It's a resolution regarding the City of Colorado Springs ballot measures related to recreational marijuana. We have had a great deal of discussion here at the board, and all those who spoke were of a like mind to support the city's initiative to change the charter, and I'm going to let Lori take it from here because she's staring at me because you're staring at every word out of my mouth. I don't want to say it wrong.
You're fine. You're fine.
Okay. But to support the city's initiative that would not allow for the sale of recreational marijuana and to oppose the ballot initiative that would allow allow medical marijuana dispensaries to also sell recreational marijuana. And so in this past month, we put together this with Lori's help, and really a variety of other people have chimed in to put together this resolution. And I want to give the board an opportunity to look it over. And also, I think this is one that I'd like us to read into record so that all of the board members are fully knowledgeable of it before we vote it in. So can we do that?
Sure, I'll read the resolution into the record. Resolution regarding City of Colorado Springs ballot measures related to recreational marijuana. Resolution of the El Paso County Board of Health. Whereas pursuant to CRS 25-1-5085A, the El Paso County Board of Health, or Board, has the authority to develop and promote public policies needed to secure the conditions necessary for a healthy community. And whereas the mission of El Paso County Public Health, or EPCPH, is to promote and protect public health and environmental quality across El Paso County through people, prevention, and partnerships. And whereas the vision of EPCPH is for all El Paso County residents to live in thriving communities where every person has the opportunity to achieve optimal health. And whereas in accordance with the Fair Campaign Practices Act, specifically CRS Section 1-45-1171B3, the board may pass a resolution and take a position on any ballot measure, question, or referred measure. And whereas the Colorado Springs City Council has referred a measure to voters on the November 2024 ballot that, if approved, will amend the Colorado Springs City Charter to prohibit recreational marijuana establishments within city limits. And whereas an initiative measure that would enact an ordinance allowing existing medical marijuana businesses in Colorado Springs to apply for licenses to operate recreational marijuana businesses is also on the November 2024 ballot. And whereas substance misuse, which is a serious public health challenge, includes the use of illegal drugs and the inappropriate use of legal substances such as alcohol and tobacco. And whereas a review of the research literature by the Colorado Department of Public Health and Environment, or CDPHE, found that adolescents and young adults who use marijuana are more likely than non-users to experience psychotic symptoms as adults, such as hallucinations, paranoia, and delusional beliefs, future psychotic disorders, such as schizophrenia, and suicidal thoughts or attempting suicide. And whereas evidence also shows that adolescents who use marijuana are more likely to not graduate high school or attain a college degree, can become addicted to marijuana, and that treatment for marijuana addiction can decrease use and dependence. And whereas EPCPH provides valuable and accurate information and resources on its website to El Paso County residents regarding substance misuse prevention, focusing on reducing and preventing youth substance use. And whereas the board encourages individuals and families to educate themselves about the risks of substance misuse and to avail themselves of the community resources available for substance misuse information, prevention, and treatment. Now, therefore, be it resolved that the El Paso County Board of Health hereby states its support for the City of Colorado Springs Charter Amendment ballot measure and its opposition to the City of Colorado Springs ballot measure enacting an ordinance to allow for retail marijuana businesses within the city. Moved, seconded, and adopted by the El Paso County Board of Health at its meeting held on September 25th, 2024 in Colorado Springs, Colorado.
Any discussion from board members? General Briggs.
Well, this is my last meeting. Many of you know my position on this, and I am just proud to be a part of this board. I'm proud that we are taking a stand for the health and well-being of the people of El Paso County and Colorado Springs. This is an issue that gets a lot of the facts are just not out there, is the way I'll put it. And seeing this firsthand, the powerful effect, the powerful psychotropic effect of what our clients at the rescue mission are enduring or going through as they use these high-potency marijuana products. I am very encouraged and pleased, and I just want to say thank you to the rest of the board members for standing up for this. Thank you.
Commissioner Gonzalez.
Thank you. I too support this. I brought it up last month because I wanted to give support to the city's efforts, and just want to highlight that this is something very similar to what we did 2 years ago when this was on the ballot with the city 2 years ago, which we opposed that, and the residents opposed that in the vote 2 years ago. And so I think we're staying in line with the position the previous board. I don't know if everybody was on that previous board vote before. I don't think the doctor was, but this is very similar and in line with the same position we took. And again, it's about the health. And I have years of experience as well working, people know Latin America, counter drug issues, and I've seen all the data, the same data that unfortunately I think doesn't sometimes make the public, needs to be highlighted, and that's what we're doing here for the general public because this is a public health issue and this is a stance that I think we should be taking. Thank you.
Thank you, Commissioner. Dr. Vu.
I also agree, and as a physician, I also personally strongly support this resolution.
Thank you. Dr. Chan?
I too support this resolution. I also have some additional comments that are resolution adjacent about the overall picture of cannabis or marijuana use. I don't know what the outcome of the ballot measure is going to be, obviously, and the board, of course, does not have any regulatory authority or taxing authority over this issue, but I would like to speak to those who do have regulatory or taxing authority, particularly for the city of Colorado Springs. I'm not really clear whether the council has the ability to impose an excise tax should recreational marijuana pass on this ballot measure. And I speak to this because obviously we know that the price elasticity of demand is probably most relevant to the population that we are most concerned about, and that is adolescents or youth, and also individuals who may not be able to responsibly limit their own use, overuse, or misuse. And of course, we know that for youth to become involved in underage consumption of marijuana, often it's because it's readily available in the home and not necessarily responsibly secured. And so I would like to speak to those who do have the authority to, especially to tax recreational marijuana should it be allowed in the city of Colorado Springs. And I would encourage an ad quantum type tax for two reasons. One is because it is not subject to fluctuations in the pricing of marijuana, and also it would be helpful in order to track the actual amounts that are used, whether there's a significant increase, should the citizens vote to allow its use within the city. And again, I would encourage, if possible, a significant excise tax in order to decrease access for those citizens that we're most concerned about.
Councilman Donaldson.
First, thanks, Dr. Chan, for those thoughts and comments. One thing is you mentioned if citizens decide to allow its use in the city, use is already allowed throughout the state of Colorado, recreational use of marijuana, so it's allowed. This would limit sales of recreational marijuana, which right now they can buy it over in Manitou Springs. And I think the city could impose some kind of a big fee on it. The thing you need to think about, though, is okay, what do they do? What do people who want it then do? And that drives a black market. That does drive, illegal sales, illegal grows, which are, sheriff's department, police department will tell you is a big problem in El Paso County. So, sometimes there's unintended consequences like that. If we put a giant tax on it, people they're going to get it anyway. So they either just go to Manitou like they're doing now, or they buy it illegally. So we will see. Yesterday, City Council passed an ordinance which restricts sales if recreational sales are not allowed within a mile of a school, and there's a few other institutions, I've forgotten what they are.
It's a church apart from the school because Palmer
There you
does
go.
have retail marijuana.
Thank you, Glenn. Just like she said. And so essentially, it won't be allowed anyway, because when you overlap all those mile circles around all these schools, churches, drug treatment facilities, et cetera, it pushes it, pretty much out into the county. Now, personally, I didn't think we needed to pass that yesterday. I think we could have waited until the vote and seen how the vote went. I don't think there was a reason to do that before the vote, but we did it. And I voted for it. Couldn't vote no once it was on the, we had to vote. So that was kind of a long answer. I think the city could do that. We need to think about it. I don't know that it would even be necessary now because we've essentially made the city a place where you can't have recreational sales except a mile away from these schools and things. And that kind of covered the whole city. That has upset a lot of citizens because they feel like we have kind of taken away their ability to have a meaningful vote in November on this issue. But we'll see how all that goes. Hopefully that was either interesting or totally confusing from your face.
There's another part of that to kind of tag team onto that that's interesting. Palmer Lake passed retail marijuana in the last election, and there's 2 facilities. But the Med, who governs retail marijuana, governs marijuana businesses in the state, has a lot of rules. So when it comes to sales tax, and you're saying a strong excise tax, and it's actually not an excise tax, it's an additional tax on top of the normal tax in your town, but it's not labeled as an excise tax. That money goes into the general fund of sales tax revenue, and it's not allowed to be split out. So because of the Med and because of protecting the nature of their business, we have 2 retail marijuana facilities, and we are not allowed to know as a board what percentage of the sales tax revenue or what monetary volume of the sales tax revenue is retail marijuana. It's lumped in. It's a protection factor. So, for instance, the number projected to the community was 1.5 million when our citizens did pass retail marijuana by a very slim margin, but it did pass. I don't believe the numbers are anywhere near that. It doesn't reflect that in the overall sales tax. But in citizens asking questions, what's the retail marijuana money? The Med protects it so much, you're not allowed to know what those numbers are.
I would like to applaud the city council for being proactive in thinking about this issue and possible eventualities rather than being reactive and then not having a policy in place should retail sales, recreational sales be allowed. I think that, obviously, any taxes that increase the pricing is, as you said, is going to maybe drive it underground or over into Manitou Springs, but that would not be any different than the current situation.
Right.
And so I would not necessarily expect use or access to go up because, even if the excise taxes drive the market elsewhere, I do think that Denver was not proactive in allowing recreational sales, and I did have a part-time residence in Denver and saw that as soon as recreational sales passed, there were outlets basically on every block, if not more than one per block. And then eventually that drove down the price of the product, and some of the establishments went out of business. But I don't necessarily think that we need an explosion of access should this ballot measure end up allowing recreational sales.
The ballot measure by the citizens to allow recreational sales limits it only to the medical marijuana dispensaries. And those would be the only places it would be allowed. So there wouldn't be an explosion of like new places opening up. They could move. They could take their license and move out to one of these areas that's not within a mile limit. Denver, I don't think it was that they didn't have forward planning. They wanted that to happen. The Denver Council believes that that's okay. Just marijuana shop on every corner is fine.
bring
Different
the,
than-
We passed the same resolution that they passed and limited the number of facilities to current medical as well when it passed, and did that proactively prior to the election. And actually, it's really important that you guys did that yesterday, because if it passes, when it passes, it only takes those medical facilities, because they're already in the mid and the med, it only takes them 45 days to change their license to retail. So the fact that you have that in place now was really important, because literally from the time of that election, it took 45 days from start to finish. The other place we were able to hang it up for a little bit was with sign.
I'm going to step in here just a moment. I want to bring our board back to the resolution. And Dr. Vu, did you have a comment?
Yes, just real quick, and I do agree with the discussion, and specifically with Dr. Chan's point. But one of the benefits of this resolution is that we communicate to our community that recreational use of marijuana is unhealthy.
Correct.
Okay.
And it's a unified standard.
Okay, I'm looking for a motion to accept this resolution as read.
I would, Briggs, for the record, I so move as read.
And Mayor Havener, thank you for the second. All in favor of this resolution, let it be known by saying aye.
Aye.
Aye. Any opposed? And there is none. It passes unanimously. Thank you for the discussion, everyone, and thank you that we are all like-minded on the topic. Would like to turn it over now to Director Whelan for her director's report.
Okay, I have three things. I'd like to introduce some new members of our team and a promotion if Amanda Hamilton can come up, and also Kat McGarvey, please. So wanted to put a face with an email that you all have been seeing. So Amanda Hamilton, so happy to have her join our team about a couple of weeks ago. She's new to our agency, and she is my executive assistant, and so she also helps out with the entire executive team, but she serves as the liaison to the board, so she will be helping out with some of the communication and organization as it relates to prep for the Board of Health meetings. And then, as you all know, I serve as your secretary to the board. And so welcome, and if you wanted to say maybe a couple of words just to introduce yourself, where you came from, and a couple decades of experience.
Yes, thank you. So I'm originally from Charlotte, North Carolina, but I've lived here in the Springs for 25 years, and most of my working experience here has been as executive assistant for nonprofit organizations. I've only been here a few weeks, but I'm so impressed with all that public health does and with the caliber of the leadership and the staff, and so I'm just really excited to be a part of everything and to get to serve the community through public health. So, thank you.
And I will say we have a lot of CSU grads, but she's a CSU grad as well. There's a healthy, competition with CSU and CU, especially within environmental health. And I'm so pleased to announce that Kat McGarvey, who previously was a program manager with water quality, and you've seen her before as it relates to leading some of the discussion as it relates to the assessment of fees and the on-site wastewater systems and such. And I know that I've been in touch with a number of board members as it relates to, if there's, something going well or if there's an issue. Kat is extremely responsive. And recently we held interviews for the Environmental Health Division Director, and Kat McGarvey has earned the promotion of serving as Environmental Health Division Director, and her first day will be with in that new role September 30th, and there will be a transition period as well, but did want to welcome her, and if you wanted to say a few words as well.
Sure. So I'm super excited to take on the new role. I'm looking forward to providing increased support to environmental health and some stabilization in that group as well. I think we have a phenomenal team and we do a lot of great work in the community. And so it's a matter of empowering our staff to continue that and increase that within our parameters. So super excited though. Thank you.
Well, welcome, Amanda, and congratulations, Kat.
Yeah. So a couple of more things. I'd like just to show a photo montage, if we can just go to that, please. I'm going to start showing some photos of not all of the work, but some of the work that is going on in the community, because I think it's very important. We're not able to highlight all of the great work that our team members do. And if you want to come up also to the podium as well with our environmental health area. And Pablo, she serves as the chair of the Colorado Colorado Environmental Health Association. And she and some other team members brought a nearly 300 attendee event to the Wolf Lodge. And this is the first time that we've had the event in El Paso County. And Pablo has been doing a phenomenal job as it relates to environmental health. And I think it's so important that El Paso County demonstrates and is a model for leadership. And you've done that. I don't know if you want to say a few words about the event.
Sure. Well, good morning, board. My name is Erin, and I'm a lead environmental health specialist in the water quality program. It was quite the endeavor planning this event, but I did have a really great team. We had members, regulators at the local, state, and federal level in attendance. We had a bunch of environmental health students and members of industry as well. So it was just a real treat to get to showcase El Paso County at a facility that we regulate in a couple of ways. And Director Whelan kicked us off, and we had a couple of our staff do presentations as well. So I'm hopeful that overall it was a great success.
Thank you. And sometimes I call people by their last name, so her name is Erin.
Okay.
I have
Happens
two
all the time.
Michelles, and I'm always like, Byerly Gunther. So forgive me for that. So thank you, Erin. I appreciate that. And then a few more events that were going on is Las Patrias downtown. We always have a presence with tobacco prevention, and we also were able to participate in a presentation at the Latino Luncheon. I was able to give a presentation about all of the good work that this agency is doing, and I could have gone on. And I do appreciate board members that are able to show up, and I know Commissioner Gonzalez, you were not in town, but Mr. Donaldson, I appreciate your presence at the luncheon. And also Commissioner Stan Vandervert has showed up, and he also he stood up and gave appreciation also to the entire public health team. And we had around 70 or more attendees at the Latino luncheon, and I thought that was really special. A couple of just notes that I wanted to say that are personal to me is that I reached out to the Pioneers Museum because I did want to get a few photos. My grandfather, Santiago Medina, started one of the first Spanish-speaking churches here in Colorado Springs, and I did not know this, but there is a feature that's going on all year long. It's called the Conejos neighborhood, and so my family has grown up there, and my mom and her 6 sisters, and then my grandfather came from the San Luis Valley, and there were photos of my grandfather and my grandmother, Paulina Medina, and so I was able to kick off that presentation as part of Latino Heritage Month as well. And so that was kind of neat within the crowd as well. And then we've also were able to give presentations and with the city of Colorado Springs with all of the military bases around Pikes Peak Rising and the behavioral health platform. And there's so much that our team does in the community that I really wanted to underscore that they are far-reaching. And as you all know, that with a staff our size and a population our size, I'm continually impressed with the work that everyone is doing. And I also wanted to say thanks to Mayor Glant Havenar as well. She attended the My Sister Live event with me, which was focused on youth suicide prevention, and that was a phenomenal panel, as well as a really great documentary and educational session, also to continue the education and what can we do around supporting the community and all the different efforts related to our youth. And so that was very special, and it was a packed house, and so thank you for for showing up to that. Really, really appreciate that. And we'll continue extending invites because I know everyone has very busy schedules, but I do appreciate the attendance.
Don't shoot me for this, but you mentioned what all your staff is doing in the Latino community, and you talked a little bit about your history, but you neglected to recognize yourself that our public health director, Susan Whelan, was named Latina of the Year by these groups. So congratulations, and you represent very well.
Thank you. Thank you. I appreciate that. And really that's illuminating my entire team because, of course, there is no individual that can accomplish great things alone. But I really do appreciate that it was the Latina Equity Foundation who surprised me with award at the event. And that's really on behalf of our entire team. So really greatly appreciate that also. And also at the Latino Luncheon, we gave a respiratory illness update. And Haley Zachary, who is our community disease program manager, she's going to provide the same update here. And we'll go from there. And I appreciate that your flexibility because that's important.
It's part of the job.
Yes.
Is this thing on?
Yep.
Yeah, flip
Okay.
it up, yeah.
All right. Has anybody known anybody who's been sick lately? Okay, so my name is Haley Zachary, and I am the Communicable Disease Program Manager. Asked to give a little update about respiratory season. So since July, El Paso County, along with Colorado and the rest of the nation, has been experiencing an increase in COVID-19 infections. So below, you can kind of see what this year has looked like in terms of hospitalizations specific to COVID. We have that increase in January and February, which we expect to see, and then it blipped down through the spring and summer months and then started to increase again. We anticipate this increase will continue due to kids being in school. That often contributes to sharing education and sharing germs go together. So just to contextualize this a little bit, our traditional respiratory season in Colorado is from October to May. And we tend to see that increase really towards December or January, and that's typically spurned by influenza, but also RSV. If you look at this graph, this is the last 2 respiratory seasons in Colorado starting in September of 2022. And while can't see all of it, this purplish line, that is influenza, and that is our traditional season. If you look at this kind of blue line that precedes it, that is what COVID has been looking like for the last few years. And so really this increase around July, later August, preceding influenza is actually becoming kind of a trend here. So although we are seeing that increase a little earlier in respiratory season, it is becoming kind of normalized, and we expect that trend to kind of be elevated through the flu season, and then all 3 of those respiratory diseases will start to come down late winter, early spring. So what do we do about it? Well, in March of 2024, CDC, along with CDPHE and us here at El Paso County, have aligned our respiratory guidance for COVID, flu, and RSV. This is huge for us in public health as well as for our partners. And what this essentially means is that we've moved away from that testing-based protocol for COVID into a symptom-based protocol for all 3. And so as opposed to saying, well, do you have COVID? Here's your guidance. Do you have influenza? Here's your guidance. What we can say is, are you sick? Here is your guidance. And so what we're really pushing for is really basic stuff. Stay home when you're sick. The primary recommendation for all 3 of those respiratory diseases, as well as multiple other illnesses, is if you are sick, stay home. If you have a fever, stay home for 24 hours after that fever resolves and your other symptoms are improving, and then you can return back to school or back to work. And obviously taking additional protocols for the next few days while you're still improving is going to help to prevent that illness from spreading to anyone else. So again, working through staying home when you're sick, using good respiratory hygiene and etiquette. So when you cough, try to cough into a tissue or into a sleeve as opposed to your hands. Wash your hands often and frequently, and use soap. Only in the absence of soap do we really recommend using that alcohol-based hand sanitizer. And then just cleaning in general. So really focusing on those areas that people touch a lot but don't think about: light switches, doorknobs, toilet handles, sink faucets, things where germs are really apt to spread, but we don't clean a lot. Thank you, Susan. Computers, cell phones, these are all things that accumulate a lot of germs that can really quickly and easily be cleaned. And then lastly, vaccines for all three of these diseases, all COVID, influenza, and RSV, are all available now. It is not too early to get vaccinated. And really with all of these, what I like to remind people is that although it may not 100% prevent infection, all three of them lessen the severity of that infection, preventing hospitalization and death in people who are at risk for those. So whether it be here at the health department, through your primary care pharmacies, vaccines are available, and it is not too early to receive those. Before we adjourn, which I can't do for you, the health department did develop a one-pager, which is available over here, and I'm sure Susan can get you all copies, but it's really just a quick everything you need to know about respiratory season for our partners. And it's got a few QR codes on there, what to do when you're sick, where you can get treatment, where you can get tested or vaccinated if you need to, and then some community resources as well. Are there any questions or concerns I can answer for anyone?
No, thank you for the update.
Awesome. Thank you.
Thank you, Haley. Greatly appreciate it. And Haley's team also, you know, as Jack, you've probably had some interactions with them, but they are a 24/7 team. And there's always something that is going on as it relates to reportable diseases. And I wanted just to extend a big thank you also to you and your team, because although we don't see your team members here, you all are responsible for a lot of different efforts, and you do it with such expertise, and I really greatly appreciate this. I think reminders are good. You're very aware of what it takes to be healthy. We did want to provide a refresher, because from time to time, you know, folks are still asking, you know, what can I do? And some of the basics of stay home when you're sick. It's not a sign of strength when you're showing up here and sick and, you know, potentially infecting, you know, other folks. And, you know, washing your hands is so simple, but as simple as it is, we need to continue those messages and continuing to help each other out in that arena. But that's all I had for my director's report. I didn't know if there were any other questions or comments.
I appreciated in the update itself, information on the retention, I guess, turnover. Great improvement from the COVID, and we all know the stress and hard work that happened greatly. It was great to see that now we're even below on turnover, so our retention is doing even better than before COVID. So that's awesome. Thank you.
I appreciate that, Commissioner Gonzalez, and we will continue to provide that report. I did want to note that you know, as you read, it does not take into account internal promotions, and we do a significant number of internal promotions, and want to emphasize that those are earned promotions as well. I mean, there's definitely a process that we go through, and whether that's internal promotions from the county to public health or internal to our agency. And when you see a 46% turnover rate that is a national rate, and that's significant. And, you know, our agency has not been immune to that. So over the last few years, we have had some turnover. And so where we are focusing on is rebuilding our foundation, and we're making progress, but that work continues, because I do know that staff feel stretched. And when you've lost some of the history as it relates to even some of the retirements, the organization has work to do as it relates to building that back. And I am happy to see that our retention is going down, because that is really great for our team. But we do still have a lot of work to do as it relates to building our foundation even stronger, and focusing on our staff. And I just greatly appreciate that you acknowledge that, because that is so important. Because if we don't have a healthy staff, then we're not going to be able to serve the public, and that is so important. So thank you, Commissioner Gonzalez.
Question about the respiratory diseases, COVID, RSV, and influenza. When there's reported hospitalizations for these diseases, Is there any indication whether these hospitalized patients have been vaccinated or not?
That is not information that we collect at the local level. They do collect that on the national level. Dr. Albanese can talk about it a little further if needed, but it's not something that we track here.
Yeah, we don't track it here specifically on the cases because not all are, sometimes it's just reporting for us purposes of counting cases, but in the metro area, there's a more in-depth, there's a special surveillance program that is done in the Denver metro area, and there's a more in-depth chart review. So we can get you that data, particularly for last season, and share that. Come back.
All right, we are at that point in the agenda where we're going to be looking for a motion to adjourn, and I'm going to look at General Briggs. What do you think?
Joe Briggs for the record. I move that we adjourn the September 2024 meeting. And thank you again for it to everybody.
Do we have a second?
I second.
Thank you, Doris. All in favor, let it be known by saying aye.
Aye.
We are adjourned. Thank you.